Today I talk about diagnostic studies of breast carcinoma. In previous 3 videos, I already told about what is breast carcinoma, risk factor and cause, pathophysiology, staging systems, types and clinical manifestations of breast carcinoma. So now I focusing on diagnostic studies of breast carcinoma. It's very interesting and important. So listen carefully. So let's start. There are some diagnostic tests which detect the cancer, and there has also some diagnostic tests which are useful for decision about the treatment. At first, I talk about pre-diagnosis. That means there are some diagnoses which detect the breast cancer or breast cancer whether or not occur. At first, health history including risk factor. There are many breast carcinoma are asymptomatic, particularly if they are discovered during a breast screening program. Large tumor may present as a painless mass. Pain or disorder is not usually the symptoms of the breast cancer. Purpose of history taking is not for diagnosis but risk assessment. A family history of breast cancer in a first degree relatives is the most widely recognized breast cancer risk. So, women who have family member with breast, ovarian or peritoneal cancer should be screened to identify a family history that may be associated with an increased risk for mutation in the breast cancer susceptibility gene BRCA1 and BRCA2. And women who have menstrual irregulation taking estrogen containing medication is the high risk for breast carcinoma. Others, women who have positive screening result should receive the genetic counseling and then BRCA testing if warranted. Next, physical examination. Physical examination is a careful manual examinations of the breast by doctor or other healthcare professional. But while it's true that most lumps are founded by women themselves, in this procedure, examine the breast lump and if there are any skin changes or nipple changes occur. In lump examination, to check the lump is hard or gritty or it is attached with the breast tissue, that's mean movable, or it is attached to the surrounding breast tissue, that is the threatened, or attached to the chest wall, that's mean fixed. In skin changes, want to check if there is any inflammation, dumpling, lymphoedema and late presentations, ulcerations occur or not. And also check if the nipple destroyed or deviated or innervated or not, and if there is any blood discharge occur from the nipple. Next, mammography. What is a mammography? Mammography is a breast imaging technique used to visualize the breast to detect small abnormalities that could suggest malignant or benign disease. This procedure takes 15 minutes and can be performed in a hospital radiology department or independent imaging center. Next, contrast mammography. It is a diagnostic procedure and that's involve injection less than 1 ml radiopaque through a cannula inserted into ductal opening on the areola, which is followed by mammography. It's performed to evaluate any abnormalities within the duct, like when the patient has bloody nipple discharge on expression and spontaneous nipple discharge or solitary dilated duct noted on the mammography. Next, ultrasound. Ultrasound is used as a diagnostic adjunct to mammography to help distinguish fluid-filled cyst from other lesion. A thin lubricating jelly is applied or sprayed over the area. The transducer transmit high frequency sound wave through the skin toward the area of concern. The sound wave that reflected back from a two-dimensional image, which is then displayed on the computer screen. No radiation is emitted during this procedure. Ultrasound is used as an adjunct to mammography in women with dense breast tissue. Magnetic resonance imaging (MRI). MRI of the breast is a highly sensitive test that has become a useful diagnostic adjunct to mammography. In this procedure, a magnet is linked to the computer that creates detailed imaging of the breast without exposure of radiation. That means in this procedure, any types of radiations are not used. For better visualization, intravenous injection gadolinium is injected. In this procedure, patient lie face down and breast is placed through a depression in table. A coil is placed around the breast and the patient is placed inside the MRI machines. This entire procedure takes 30 to 40 minutes. MRI is useful for evaluations of contralateral disease, invasive lobular carcinoma, and also the assessment of chemotherapeutic response. Next, procedure for tissue analysis. In this procedure, there are two types of biopsy can be done: percutaneous biopsy and surgical biopsy. So, at first I discuss about percutaneous biopsy. This is performed on an outpatient basis to sample palpable or non-palpable lesions, and it is less invasive than the surgical biopsy. Percutaneous biopsy is a needle or core biopsy that obtains tissue by making a small puncture in the skin. There is also different types of biopsy. We will discuss one by one. At first, fine needle aspiration. This is a biopsy technique that is generally well tolerated by the most women. In this procedure, local anesthesia may or may not be used. What happens in this procedure? A small gauge needles attached to the syringe is inserted into the mass or area of nodulatory, and suction is applied to the syringe, and multiple passes are made through the mass. When a simple crest disappears on the aspiration, then the fluid is usually discarded. But if no fluid is obtained, only cellular materials obtained into the hub of needles, then it's spread on a glass slide and placed in a preservation and sent to the laboratory for analysis. It's less expensive than other diagnostic methods and results are usually available quickly. But false negatives or false positive results are possible. Core needles biopsy. It is similar to fine needles biopsy, except a large gauge needle is used. Local anesthesia via a spring-loaded device, and this procedure allows for more definitive diagnosis than the fine needles aspirations. Next, stereotactic core biopsy. In this biopsy, performed on the non-palpable lesions, which is detected by the mammography. In this procedure, patients lie prone on the stereotactic table. Breast is suspended through an opening in the table, compressed between two X-ray plates, and images are obtained using digital mammography. This type of biopsy is quite accurate and often allow the patients who avoid the surgical biopsy. Next, ultrasound core biopsy. It is similar to the stereotactic core biopsy, but in this procedure, ultrasound guidance are used, and there is not needed computer coordinations and mammography compressions. In this procedure, does not use radiations, and it's also usually faster and less expensive than the stereotactic core biopsy. Next, magnetic resonance imaging guided core biopsy. It can performed when the abnormal area in the breast is too small to be felt but is visible on MRI. It can be performed by radiologist and technologist. Next, surgical biopsy. In this procedure, incision is made firstly, then the lesion is excited and which is sent for laboratory for pathological examination. And this procedure usually performed by local anesthesia or intravenous sedation. There are mainly two types of biopsy under surgical biopsy. The types are excisional biopsy and incisional biopsy. So, let's discuss about in these two types of biopsy. Excisional biopsy. In this procedure, entire mass plus margin of surrounding tissue is removed. It standards biopsy for complete pathological assessment of palpable breast mass, and these types of biopsy may also be referred to as a lumpectomy. Next, incisional biopsy. In this procedure, remove a portions of mass, and this procedure is performed to confirm a diagnosis and to conduct special studies that will help in determinations of treatment. So, there is over procedures of tissue analysis. Now I discussed post-diagnosis of breast cancer. At first I talk about lymphatic mapping or sentinel lymph node detection. It's helped the surgeons identify the lymph node that drain fast from the tumor site. And sentinel lymph node detection is less invasive than axillary lymph node detection. What's happened in sentinel lymph node detection? In this procedure, a radioisotopes or blue dye is injected into the affected breast, and intraoperatively it determines in which sentinel lymph nodes are radioisotopes or dye is located. A local incision is made into the axilla, and the surgeon dissects the blue stain or radioactive sentinel lymph node. And these sentinel lymph node detections on to fourth axillary lymph nodes are removed, which are sent for pathological examinations. If the sentinel lymph nodes are negative, there are no further axillary surgery is required. But when the sentinel lymph nodes are positive, a complete axillary detections may be done depending on the patient's clinical situation. All are understood? So, let's move on. Another diagnostic test, estrogen progesterone receptor status. It is another diagnostic test which is helpful for decision about both treatments and prognosis. So, when the tumor is positive for estrogens and progesterone receptor, it commonly shows histologic evidence as well as differentiated, and it's frequently have a diploid DNA content and low proliferation and lower chance to recurrence, and it's have frequently hormone dependent and responsive to the hormone therapy. But when the tumor is negative for estrogens and progesterone receptor, the tumor is histologically poorly differentiated and higher incidence of aneuploidy and frequently recur and unresponsive to the hormone therapy. Next, cell proliferative index, which indirectly measure the rate of tumor cell proliferations and the percentage of tumor cell in synthesis S phase of the cell cycle, is another important prognostic indicator. Patients with cells that have high S phase fractions have a higher risk for recurrence and earlier cancer death. Next, HER2 marker. It is another prognostic indicator. Its overexpression of this receptor has been associated with unusually aggressive tumor growth, and it's a greater recurrence and poor prognosis in the breast cancer. 20% of breast cancer produce excessive HER2. Presence of this marker assists the selection and sequence of drug therapy and predict the patient's response to the treatment. Next, genomic assay. In this test, a sample of breast tissue used to analyze the activity of group genes, and we know which certain genes are present or absent, are overly active or not active enough, which can provide information about the risks of recurrence and the likely benefits of chemotherapy or hormone therapy. There are mainly two genomic assays are used in currently for breast cancer. One oncotype DX and other MammaPrint. So there is over post-diagnostic studies. Now I will discuss diagnostic studies at staging. At first, complete blood count. Before and during treatment for breast cancer, doctor will order blood cell count for checking to see whether the blood has normal count of the various types of blood cell. Blood cell count typically measure white blood cell, which function as a immune system cells that defend our body against foreign substance and invader. If you have a low white blood cell count, you have a higher risk for getting an infection. And red blood cell, which carry oxygen throughout the body. To measuring the numbers of red blood cell, a test will be done to measure the levels of hemoglobin and iron-rich proteins found in the red blood cells that carries oxygen from our lungs to the rest of our body, and platelet, which are cells that helps our body form clots and prevent bleeding. So, before treatment being blood cell count may be used to determine whether you have another medical conditions like anemia. So, it is needs to be addressed first. And abnormal cell count can be indicated that the cancer spread to the bone marrow, like spongy tissue inside the bone where the blood cells are made. And during chemotherapy, it will be checked before each of treatment, because chemotherapy medications can significantly reduce the level of blood cells your body should have. If the count is low, doctor can give medications called growth factor to stimulate growth of certain types of blood cells. Example, Prokit to increase red blood cells and Numega to increase the platelets count and Neupogen to boost the white blood cells. So, complete blood count is important studies before and during treatments of breast cancer. Next, blood chemistries test. These tests measure the level of certain substance into the blood and can verify whether or not various organs are healthy and functioning properly during the treatments. These tests can be done to measure the levels of liver enzymes and bilirubin to evaluate the liver functions, and level of potassium chloride and urea nitrogens reflect the health of liver and kidney during and after the treatments, and level of calcium may indicate or determine to bone and kidneys health. Blood sugar level, which is also important. If there is any abnormalities chemistry test, it may suggest that the breast cancer has spread to the bone, liver or kidney. Then the doctor will order an imaging test such as CT scan, bone scan, like etc. Next, chest X-ray. Before beginning treatments for invasive breast cancer, you will have a chest X-ray to check whether the cancer has spread to the lung. During treatments for breast cancer, chest X-ray may be used to determine some situation. Those are, if a patients have advanced breast cancer that have spread to the lungs, here chest X-ray is used to check how the disease is responding to the treatments. Another, for people who develop fever during the chemotherapy, chest X-ray are used to check for the presence of pneumonia. And if a person experience new shortness of breath in first few months after radiation therapy with or without cough, then doctor may order to chest X-ray to see if the radiation causes any inflammation to the lung. So, chest X-ray is very important before beginning treatment and during treatments of invasive breast cancer. Next, bone scan. It's also called bone scintigraphy. It is a imaging test to use determine whether the breast cancer has traveled to the bone. And during and after treatments, patient has experienced persist bone and joints pain, then doctor may be ordered to bone scan. Next, CT scan. It also called CAT scan, computerized tomography scan. It is a X-ray technique that gives information about the body's internal organ in two-dimensional slides or cross section. These tests are not routinely to evaluate the breast, but if you have a larger breast cancer, doctor may order a CT scan to assess whether or not the cancer has moved to the chest wall. And it's also determine whether or not cancer can be removed with mastectomy. And it's also to examine other part of the body whether the cancer can spread, such as lymph node, liver, lungs, brains or spine. So it is also very important test to invasive breast cancer. Next, PET scan, that's mean positron emission tomography. It's not widely used women for breast cancer. It has only a limited ability to detect small tumor. PET scan can be useful for evaluating people after breast cancer has already been diagnosed in a number of different ways. That's a likes to determine whether the cancer has spread to the lymph nodes and to determine whether the cancer has spread to the other parts of the body like liver, lungs, bone, etc. And to assess whether the metastasis breast cancer responding to treatment. Quick recap: diagnostic studies of breast cancer. There are three parts: pre-diagnosis, post-diagnosis and staging. Under pre-diagnosis, health history including risk factor, physical examinations, mammography, contrast mammography, ultrasound, electric resonance imaging and procedure of tissue analysis. There are two parts: percutaneous biopsy and surgical biopsy. Under percutaneous biopsy, fine needle aspirations, core needle biopsy, stereotactic core biopsy, ultrasound core biopsy and MRI guided core biopsy. Under surgical biopsy, there are two parts: excisional biopsy and incisional biopsy. Next, post-diagnosis. There are lymph mapping and sentinel lymph node dissections and estrogen progesterone receptor studies, cell proliferative incidence and HER2 makeup and genomic assay. And staging: complete blood counts, blood chemistries, X-ray, bone scan, CT scan and PET scan. Oh my god, it's too large, but most important. I think all guys here understood easily. So there is end. And please subscribe my channel.